This is Jerry Hesch from the Hesch Institute in Henderson, Nevada, very close to Las Vegas, and this is a wrap-up on our case of chronic foot pain, cuboid syndrome. And our website is www.heschinstitute.com. And this is a interview of the client and his mother. And to protect their privacy, you get to look at a foot while they speak. So I'm gonna let Kyle speak to us and tell us about his experience.
So, as I previously stated, I've had a lot of problems with my foot over the past 5 years. It's incurred a lot of trauma, originally induced by an impact injury. When I first injured it, I did see a chiropractor, and he diagnosed a sublux cuboid and did put his thumb on it and pop it back in place, and I did feel a considerable amount of relief, but it was short term, and then set in motion a long journey of trying to discover what could be wrong with my foot, and had another surgery. And it's been 5 years. I've spent 4 years between a wheelchair and crutches, and the journey's taken me here to see Jerry, and he was able to diagnosed me from what he calls a type 2 cuboid syndrome, which entailed a lot more than just the cuboid bone being locked up, and was able to go through my foot and my hip and leg and manipulate the joints in order for them to open up and become back to their proper origin. And I do feel a lot better. I feel a lot freer. And I feel like he's given me the tools that will allow me to recover to the best of my ability.
And in your course of seeking care, at what point did you get the diagnosis of cuboid syndrome?
Never.
I mean, wasn't it the chiropractor manipulated the cuboid?
The original chiropractor that I saw up in Atlanta a couple months after I had the initial injury did diagnose a sublux cuboid bone. But other than him, I mean, that was 5 years ago. Other than him, no other orthopedic or any other doctor, which I've seen, close to 100 different specialist doctors, what have you, have even recognized or come close to diagnosing a cuboid syndrome.
And he tried, the cuboid manipulation he did gave you about 5 days of benefit, but you could never achieve that again, is that correct?
Correct.
Hence, there probably was a greater complexity, the type 2 cuboid syndrome that I described, in which all major bones in the foot and ankle complex, even the superior tib-fib joint, even the hip joint are involved. And your out-of-pocket expenditure over each year over the past 5 years?
Over the 5 years, it's amounted to, close or over or 6 figures.
Yeah, somewhere in 6 figures out of pocket, and then of course the insurance was above and beyond that.
Correct.
So it's been, for a joint in the foot, it's been a very costly endeavor.
Definitely.
The 3 surgeries were what, please?
Cost-wise?
No, I'm sorry. You had 3 surgeries.
I did.
What were they?
After the second fracture,
of the metatarsal.
the 5th metatarsal Jones fracture, they put a pin in that 5th metatarsal head. The orthopedic said I could be, back on the field playing lacrosse in about 5 weeks. I could barely walk after 5 weeks, and that was the end of my lacrosse career. 6 months later, I elected to have that screw removed, and felt like I got back to 100% after about a year and a half, and then that's when I started taking my feet for granted again and re-injured it about 5 years ago, and that's what set in motion this whole deal.
Right, so that first fracture surgery was greater than 5 years ago.
Correct, that was in 2006.
Alrighty, thank you. And then you had a surgery to the foot.
In 2009, exploratory surgery. They went in and deep-reeded that 5th metatarsal head and removed the bursa of that peroneal brevis attachment there, which caused me more complications and pain in the long run.
Very good. Thanks. Just wanted to clarify that history. And now if his mother could kind of give her input, I would be grateful.
Well, of course, when your son is physically injured, you want to get help. And we thought, we took our normal route, which I typically go alternative, and went to everybody that I could think of to help him heal. We were confused to know if it was actually bone or something chemically in his body for lack of healing, because nobody would give us a diagnosis. With that said, being your child, I told him I will go to the moon and back. So every time we came back from one trip, we got in the car, we were scheduled to see the next person. We played both sides of the fence. We went medically and alternative. And Kyle was still in such pain that he was in and out of the wheelchair. And he finally realized that in about a year ago that he had to get out of the wheelchair, or the atrophy was just going to not allow him to ever get out of it. So he had to just live with the pain. He fought taking painkillers, had to resort to it periodically just to get through his days. And then a week ago, he called me in the morning and said once again he can't get out of bed, can't put that foot on the ground. So with my faith, I sat before my computer and asked for a miracle. And I was very blessed to have come across Jerry at the Hesch Institute. We immediately got a flight, came out to Nevada, and saw that what we felt in our heart was jammed all along, but couldn't get anybody to help us. We saw that his foot was totally jammed. And in the first visit, I think as you recorded, in about 7 minutes, you brought mobility to his foot. And we've spent 3 days, and not anywhere near the money that we have spent without any hope. And now it all makes sense, and I know that my son will have a healthy life, physically and mentally, because mentally it is very difficult for somebody to live with pain.
And today we saw him stand on that foot with the other foot lifted up,
Picked up his
not
other
holding on to
foot
anything.
without
Stork standing.
Yeah.
So that was very encouraging.
Yeah.
And so, for me, the take-home message here is that cuboid syndrome is a valid diagnosis for some, but sometimes it is a much more complex phenomenon that involves all major articulations through the foot and ankle. And because he got relief once with a cuboid whip, then too much focus on the cuboid joint, as opposed to, well, the calcaneus controls the cuboid and the subtalar controls the calcaneus, but as far away as the hip, and you have to look at the navicular, the midfoot, the ankle joint, yada, 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 that cuboid syndrome type 2, which I've described, is a more complex pattern. And so people who suffer without getting relief from a diagnosis of cuboid syndrome should also realize that there is a more complex pattern called type 2 cuboid syndrome. And I hope that more and more clinicians will become aware of this, and so that we can prevent this kind of protracted care. And I thank you very much for your summary.
Thank you.